I wasn't me and I didn't know everything about joints and I couldn't find somebody to give me a joint assessment, these are the 5 things that I would do to get out of pain and build the strength to feel better. Elbow pain isn't all the same. Okay, it could be because your wrist doesn't work, or your elbow doesn't work, or your shoulder doesn't work. Most of the time, it is a shoulder or wrist problem, and the elbow is just taking a beating. Think about it this way: there's golf elbow and there's tennis elbow. Both of those pains are in different areas. And it also really depends on the repetitive movements that you're doing. So I got this question about what about elbow pain when I'm weed eating? And honestly, that makes a lot of sense because you're holding the weed eater up with your elbow in flexion the whole time. So are you using your bicep? Are you using your lat and your shoulder to hold it? Are you just squeezing and trying and hoping that your wrist is holding it up? Or are you loading everything properly and utilizing what you're supposed to be utilizing? First, we want to manipulate and smooth out the fascia in our forearm and possibly in our bicep and tricep. We want to start from the bottom or start from the top. Don't just start in the middle, okay? So we can do this all the way up. Take your hand, twist your skin and your muscles, literally twist it. So twist it out. And when you twist it out, you may already feel good relief. That's awesome. From this position, we are going to then bend our elbow while we are pulling on that skin and that muscle, bringing it all the way up. And then we're going to let it go back down. We're going to do that about 10, 15 times. And then we're going to keep this skin twisted out to the outside. And we're going to make a circle around our body and back around. I do that 8 to 10 times. You want to work your way up your forearm, pushing the skin out and bringing it in. So if I bring it in, if that brings on more relief, then that's awesome. I'm then going to let my arm come up, come back down a few times, and then I'm going to do my circles. You may already feel a lot of blood flow and relief into your hand and possibly your elbow. But we do want to go all the way up and make sure it's not a shoulder problem. So take your bicep and your tricep and twist it out. And we're going to do the same thing. We're going to go into lifting and flexing that elbow, extending that elbow. And then we're going to do the same thing. So twist it in, bring that elbow into flexion, bring that elbow into extension, flexion, extension. Feel wonderful when you get all the way up to where your bicep and tricep meet your shoulder. And you're going to rotate that skin into external and then go into your elbow flexion and extension, taking it and then going into pulling it in towards you and then going into that flexion and extension. Already feels good. That's wonderful, but we can't stop there because that is just helping blood flow and things move easier. It's not actually building strength at the tissues and repatterning how they move so that the elbow pain doesn't come back. Cars with no weight at first, and then we want to load them because we want to make sure that we are really moving the elbow. So imagine this bone right here is rotating in and rotating out, back and forth. When your palm comes towards you, you don't want to just use your wrist. You want to make sure that your elbow is rotating everything. And when it does, it will create a little bicep right here. And then when we rotate it in, we're going to notice that our triceps starts to fire. And if it doesn't, that's okay. We want to do these rotations by putting our elbow down so we can have that feedback at the elbow and so that we can keep our arm level, because if we're down here, we're probably going to use our shoulder or our wrist. So if we have it nice and level and we rotate down, leave the palm down, bring it back as far as you can. Rotate the elbow where it's nice and close as far as you can. Let it out. And then rotate the elbow when it's out there. Bringing it back. And we want to do a few of these on both elbows, but of course the elbow that is hurting. Then you want to load it, and it's really nice to use a hammer, not a dumbbell, because a dumbbell is going to be loaded on both sides, and you're going to feel the difference when you just have one side loaded, kind of like a Indian club. So we're going to take the hammer and we're going to hold it like we're about to hit a nail. We're going to get into that position that we were just in with our elbow up. We're going to have our palm facing us, bringing the hammer as close as we can to our shoulder. And we're going to go ahead and leave the palm facing up, going into extension. And then we're going to rotate the elbow internally. So the head of the hammer is now rotating, not just at the wrist. We want to make sure that the elbow is doing the work. And then we want to pull that guy back as far as we can and push it back forward. And then at the elbow, bring the hammer over and repeat. Most people do not have a flow rope or don't really know how to make one or don't want to make one, but you can just grab a towel and make one. If you want the exact tutorial on how to do this with a towel, just DM me or comment and I'll get to you. We want to hold the towel because this is going to really help us understand if our shoulder is internally rotating and externally rotating, or if we are always compensating with the wrist or the elbow. If I'm compensating with the wrist, then the rope is going to just move like so. If I'm compensating with the elbow, then my elbow is going to be moving and doing everything. But if I am utilizing my entire arm, the whole line, loading it, I'm then going to feel relief in that elbow. So you want to play with this. You want to see if going overhand, which means that's kind of like a throw. So my palm is going to come over and then it's going to flip. So this flip is an external rotation in the shoulder, not just in the elbow. But you're going to notice in that overhand pattern if you're just rotating at the elbow, and that means that that is causing a big restriction because we want to have that fluid motion of that elbow going into rotation and the shoulder going into rotation, coming back, and then the shoulder comes internally rotating, the elbow is internally rotating, external at the shoulder and the elbow, coming back and forth. That's underhand. And then I'm going to rotate my shoulder and my palm now is going back towards me. And then it's going to come up. So I'm going to create this nice figure 8. But I am rocking to the left, rocking to the right, left, right. The teacup drill. Yes, my teacup has a cat and flowers. And yes, there is water in here. I hope that didn't ruin my mic. It can be done standing, seated, all kinds of ways. Honestly, it's going to be amazing if you do it in every position. So I'm going to show you standing because you're able to use your spine more and make it a full body thing that leads to your elbow feeling better because your elbow is attached to the rest of your body. If your body's not moving properly, your elbow might take the beating. The teacup, or honestly, just take a book at first. Into the palm of your hand. You're not going to try and grip the teacup. You want to try and balance it. And from this position, we are going to take our shoulder internal, allowing our elbow to rotate as much as we can as well. We should feel this start to load our lat back here, and you should just feel your back line working more. And that means that, yes, I am hunching over, but you can just stand still if you have good enough shoulder mobility. But most people don't have a good enough shoulder mobility to just stand here in one position. And so utilizing how your body coils to get this teacup to come up is going to be the best way to do this. How that happens is the teacup is in my hand, and as I internally rotate my right shoulder, I'm coiling my left elbow into my left hip, and my spine is laterally flexing and crunching to the left. So I'm crunching head over left foot, and I'm bringing the teacup out as much as I can. And then I can rotate my spine and shift to the right leg as I keep pressing up and then coming all the way up to standing. And then to go in reverse, we're going to do the same thing. I'm going to shift and rotate my spine to the right where the teacup is as much as I can. I'm going to crunch and coil to my left hip as I internally rotate my shoulder, start to bring it down, rotating my spine to the left, and then bringing my elbow around, and we're back in the first position. So you can enjoy the full movement of this teacup drill that you can do every morning with your tea or your coffee.